Weekly Checkup, brought to you by Dignity Health Central Coast.
The heart has 4 valves, and their purpose is to keep blood traveling in one direction through the heart. Dr. James McPherson at St. John's Regional Medical Center explains.
If the valves are not working, it's either because they're not opening properly or they're not closing properly. A valve that doesn't open properly is called stenosis. That can happen with the aortic valve, aortic stenosis, or the mitral valve, mitral stenosis. If the valve is leaking, that's called an incompetent valve. So it can be aortic insufficiency or mitral insufficiency. It's also referred to as mitral regurgitation. Those problems can cause shortness of breath, they can cause leg swelling, and ultimately lead to congestive heart failure. And that means the heart is not functioning properly as a pump. So congestive heart failure can be deadly if it's not corrected.
Treatment is either to repair or replace the diseased valve.
The aortic valve, usually when that valve is diseased, it needs to be replaced, either a mechanical or a tissue valve. Repair is usually only applicable though for the mitral valve, and that gives the patient the benefit of having their own tissue. As long as they're in normal sinus rhythm, they don't have to take anticoagulation for the rest of their lives. But the key thing is that early surgery provides the best results. By getting the diagnosis, making the diagnosis early, and then treatment, that is the path back to an active lifestyle.
For more information, visit dignityhealth.org/Central Coast.
Weekly Checkup, brought to you by Dignity Health Central Coast.